Good morning, good afternoon, good evening, everybody. Thank you very much for joining for this webinar. I would like really to welcome all of you, and I hope you are all keeping healthy and safe. I know it's very challenging time and tough time for all of us. I am Najat Roshdi, and I'm hosting this webinar as the director of the peer-to-peer support program, and we will be addressing issues related to community engagement and communication strategy at the local, national level. Before moving to the speakers, please make sure you are on mute through the course of this webinar and have your camera turned off at all times during the webinar. Our speakers can unmute and ask questions on the floor, and all the participants can post their question using the chat box. Now let me move to the topic itself. In line of the security measures and in most of the cases, total lockdown, community engagement is very challenging for all of us. In crisis such as COVID-19, informing, communicating, engaging, building trust is more and more challenging, and we see that also every day with the fake news and misinformation in the social media. So coordination, communication, and compassion are more than ever very much needed. Our speakers today will take us through existing tools, approaches, and will provide us with very concrete examples in communicating, coordinating, and engaging with the communities, creating the much-needed trust to protect them from the infection, to prevent and to treat. It is my pleasure now to welcome and introduce the speakers today. I am pleased to welcome Tanya Woods, the Executive Director of CHF Alliance, Charles-Antoine Hoffman, Senior Advisor, Community Engagement and Accountability in UNICEF, Melinda Frost, Infodemic Management, COVID-19 Response Risk Communications and Community Engagement Lead in WHO, Fiona Gall, Director of ACWAR in Afghanistan, and Alexandra Sikot-Levesque, Manager of Community Engagement in IFRC. Without further ado, let me address the first question to Melinda. Melinda, can you tell us, please, what are the steps that have been taken to mitigate the spread of wrong misinformation during the COVID-19? Over to you, Melinda.
Hi, thanks for having me today. Yeah, I'll give the talk about the approach that WHO has been using to mitigate the spread of mis and disinformation. I think maybe many of you have seen this term infodemic. Our response this year with this pandemic of COVID-19 has been, we've taken a new approach to this to try to mitigate the issues surrounding mis and disinformation throughout the response. You can go to the next slide, please. And through this, I think we're seeing sort of a new area of response surrounding misinformation. And we've often said at WHO, we're not just fighting an epidemic or a pandemic, we're fighting an infodemic where there's so much information that it's difficult for individual decision makers, be they leaders, community leaders, or parents, to find the information they need to make the important and relevant decisions they need to make in their daily lives to protect their health. Next slide, please. So we've been doing this through a couple different ways at WHO. We're gathering more and more data, I would say sort of at the artificial intelligence level, but then also through behavioral insight, so that we're getting a bit of ground truth in the type of information that we're trying to share and the ways that we're sharing it globally. So currently we have a number of different reports going through media, mass and social media, where we're gathering key questions, rumors, and myths that we're trying to debunk. And also we're gathering some behavioral insights through a couple different mechanisms. One reached out to 60 countries, and another one is a behavioral tracker from Imperial College. It reaches out to about 30 different countries. So we're kind of gathering that information, those questions, and that misinformation, misunderstandings from two different levels, and then it comes together in the middle where we really decide on the type of information and the strategies that we're going to use in the coming weeks. And we also balance that directly with the information coming into WHO, both at the global, the regional, or not both, but at the global, the regional, and the country levels as well, to make sure that we're addressing all of these issues. Next slide, please. And then what we've really been working hard to do is to simplify the science. I think almost on a daily basis at WHO, we're learning something new about COVID too. So we're trying to ensure that we share that information and those changes in science on a regular basis and make it understandable, explaining why these changes are occurring and why that's good that we're finding out new information. Yeah, and we're getting a lot of feedback at the country level to try to better share this information in a way that's palatable and understandable to country and local levels. Next slide. We've also been reaching out through what we're calling amplification networks. We're reaching out to business and employer and employee networks, faith-based organizations, healthcare workers, food and agriculture, high visibility events, so sporting events and so on, to make sure that our information is tailored in such a way that these different audiences can not only use it, but also then take it and share it. So we've worked really hard to make sure that these amplification networks are actually enabled to share and impart the information that we're giving. And we're tightening up some of these networks too, particularly with young adults and faith-based organizations, to make sure that we have regular information and guidance going out to these networks to better reach local communities. Next slide, please. This is just one example where we've had a lot of amplifying actions in faith settings. So we worked with a number of different organizations around the world, including our partners at UNICEF, to develop guidance on faith setting and safety against COVID, to make sure that if faiths are joining together, congregating, that they can practice safe services or be effective at doing distance-based services as well. And you can see that this is going to become even more important now that countries are coming out of public health measures and lockdowns. You can see that more and more individuals are returning back to their faith settings. So I think we're going to have to renew this information and make sure that it's getting out through our networks again. Next slide. So some of the things that we're doing that'll provide a bit more information at the country and local level is that we're starting an infodemics observatory where we're going to be able to begin to measure population exposure to misinformation. We're setting up a digital literacy network, and then also employing what we hope, well, not employing, hiring, but like gathering more and more individuals to be trust and drivers of acceptance in public health measures. So again, using our amplification networks to drive trusted science-based information through their networks. And I think that might be it. I'm not sure for the slides. No. The other thing that we're starting to is cooperation through UNESCO to be able to share our updated science information through scripts on radio shows. So reaching out that way as well. I believe that's it for me. Over.
Thank you very much, Melinda. Well, Alexandra, Melinda told us about how important it is actually to convey the right information and to counter any misinformation. We know that in some cases we have a total lockdown. It's very difficult actually to move. So tell us about the challenges in engaging with communities remotely during this pandemic and how this is happening. Over to you, Alexandra.
Thanks so much, Najat, for the opportunity. If I can ask for the next two slides. Yeah, perhaps the next one. Thank you. So as you said, COVID-19, the pandemic is presenting us with unprecedented challenges, especially when we talk about community engagement. The way we do community engagement is different. We have to innovate. We have to think differently because of physical distancing, of course, because of lockdown, etc. But before I go into a bit more on what that means specifically, I just want to build on what Mindy just explained as well about the importance of trust. And this is something we've really learned in recent epidemics and, of course, in other humanitarian emergencies as well, is that to ensure that community engagement is effective, but also that our response is effective, especially, we need to have the trust of community. And of course, this means that we need to start where communities are and at the center, and make sure they are at the center of the action. But especially, I think it really means that we need to listen to communities and we need to act on that, which is especially complex in this current situation. This is something that we learned potentially the hard way in the recent Ebola response, for instance, in the Democratic Republic of the Congo. And for us at the Red Cross, we had a specific example around communities who didn't trust or safe and dignified burials because we realized after setting up a thorough community feedback system that there were beliefs and misinformation that were circulating in communities about the fact that perhaps there was organ trafficking occurring during safe and dignified burials. And the reason for that, we realized, was because we were using opaque body bags instead of transparent body bags. So we decided to change our procurement measures and to procure instead semi-transparent body bags so that people could see their loved ones being buried. And the fact that we listened to the community and that we changed our programs and our services without trying to convince the community otherwise is really something that we saw had huge impact on the way the communities trusted our work and the services we were provided. And we definitely saw an uptake in safe and dignified burials after that. So this is really central, I think, this point of really listening and acting on feedback. I think there's a lot of emphasis, of course, on the misinformation that's circulating as part of COVID, and we've become almost obsessed in a way with the issue of rumors. But it's especially essential for us, if we're going to have the trust of the community, to listen and for us to act on what we're hearing, as opposed to just trying to push, of course, information out. So if you can go to the next slide, please. So, of course, Mindy went a bit through that, but I just want to very quickly look at the different areas that, of course, we talk about when we talk about community engagement, and things that we can still do despite the unique aspect of COVID-19 right now with physical distancing. So, of course, it's about listening and rumor tracking, as I just explained, understanding beliefs and fears and why where are these coming from, as well around motivating individuals and the social responsibility and really focusing on community action specifically. And ultimately, as well, it's about involving communities in planning the solutions. Next slide. So obviously for us, especially at the Red Cross, Red Crescent, a face-to-face interaction thanks to our wide network of volunteers is very different today because of COVID-19. However, it still doesn't mean that we can't do it, of course. So we are trying to negotiate in case-to-case basis with governments if there are lockdowns to ensure that social mobilization or community engagement can still take place as a critical measure for prevention of COVID-19. So these are different ways that we've been looking at in the current situation to ensure that we continue community engagement activities despite the current challenges. So one of the things, of course, is around technology. So pre-positioning phones, tablets, radios with community groups and volunteers, ensuring that those communities that might not generally have access to specific technology might now be supported with that if possible. Of course, it's also about mapping which activities are still taking place. So, of course, food distributions, for instance, are still taking place, right? So how can we still conduct community engagement activities? How can we ensure we collect feedback from communities, understand their concerns, etc., as we are doing these services, ensuring, of course, that we are respecting health measures and physical distancing measures while we're doing that. Of course, now we're hearing more and more the aspects around technology, how important it is. So, of course, if we can leverage different types of technology, WhatsApp has been very popular. We have set up, for instance, for us a WhatsApp line in Peru with migrants there to ensure that they have not only information on COVID, but also we're trying to understand what questions they have, what concerns, and how we can adapt our services based on that. Of course, in a lot of countries today, radio shows as well can't be underestimated. Their reach is very wide, and it's also a great tool for us to be able to listen to communities as well, not just to impart information, but through call-in radio shows to be able to answer specific questions that communities might have. But all this, if I can say, is really important to do not in isolation. So, of course, there's different local organizations in a country. The Red Cross, Red Crescent might be one of them. But how can we work together and strengthen what is already there? Obviously, a lot of organizations will already have perhaps feedback mechanisms or different communication channels to interact with communities. So how can together, in the collective, can we leverage those existing mechanisms instead of creating new ones and just building on what different organizations already have, and how can we just bring it together for a more coherent response? Next slide. So one of the things we've been doing, for instance, at a regional level for us in the African region is thanks to 20 different national societies who are conducting different types of community engagement activities through different types of channels. We're trying to start analyzing the different trends that we're seeing across the region. Again, this is done mostly remotely, right? Because we don't have access to a lot of these communities. And so we're still able to capture the different kind of trends around the misinformation that's circulating, the concerns, and which is helping us adapt our response, not just at the regional level, of course, but also in these different countries. Next slide. So ultimately, I think no matter the challenges that we have in terms of physical distancing and health measures, et cetera, I think what remains important is that there are still different ways that I just showed that how people can remain involved and contribute to the discussion around COVID-19. And like for us, I think behavioral science evidence has really shown that when people have this sense of agency, ownership, and understanding, there's definitely, it builds trust, and ultimately it is one of the main ways to really end an epidemic. So here you have on the slide different ways that our Red Cross, Red Crescent organizations, but this is specifically for Africa, have been able to set up different community engagement initiatives despite the current limitations with the COVID-19 response. So I've already spoken too long, so I'll end here, but I'm happy to answer more questions. Over.
Thank you very much, Alexandra, for all those very concrete examples and tools. And let me remind the participants that actually the PowerPoint presentation will be available on our website, and Venkatesh is going to send out to everybody the address, and the webinar is recorded. Now let me move to the third speaker of this first set of presentations, and that's you, Charles-Antoine. I mean, it is we have different actors who are involved in conveying the information, in communicating, and in supporting the population. Of course, this is calling on a big deal of coordination. Can you please tell us how actually communication and community engagement are coordinated among partners during the COVID-19, and what is different from the business as usual? Over to you, Charles-Antoine.
Can you hear me?
Charles-Antoine, can you get closer to the mic, please?
protected?
Silence one.
Hello?
Yes, we hear you very well.
Sorry, I really have trouble with my headphones. Sorry. Anyway, thank you very much, Najat, and a great pleasure to be on this webinar. Indeed, I will focus mainly on the coordination aspect around what we call risk communication and community engagement, focusing mainly at country level, but I will also touch on some of the global efforts we are currently undertaking to support countries. As I'm sure everyone knows, risk communication and community engagement is one of the key pillars of the public health response, and is also a strategic objective of the global HRP. So it's very central in the response, and I think that came up very clearly from my colleagues Alexandra and Melinda before, in terms of the importance of these approaches. I'll use the acronym RCCE. Forgive me for that. That's the only acronym I'm going to use, but that will make it a little bit shorter. RCCE is currently co-led by IFRT, UNICEF, and WHO at global level, and it takes different shapes at country level depending on the context. So far, most countries have established RCC coordination working groups or similar setups. They are very often led by the Ministry of Health, and they are part of the national COVID-19 response plans. And in several countries, such as Pakistan, Iran, Indonesia, South Sudan, DRC, and many others, UNICEF, in collaboration with WHO, other UN agencies and NGO partners, support the RCC coordination, and as I said, working very closely with the Ministry of Health. In some situations, on a growing number of situations, countries have some existing community engagement and accountability working groups. They are usually set up in a humanitarian context, and in places such as in CAR or Yemen, they fall under the leadership of the HET, and in those contexts, these groups tend to do much of the work which is needed to support RCC coordination. These groups, they tend to work very closely with the clusters and obviously in support of national health authorities. We actually, I would say, discourage establishing parallel coordination mechanisms, and whenever, before COVID-19, when those groups exist, they should be really encouraged to play a leading role, and we should tap on the existing expertise that exists within these groups and different partners working together. And we've seen this happen in many contexts. Developing a plan of action for RCC, and that's on the right slide, to support national response is usually one of the first tasks that partners would do at country level. We have so far 149 countries which have developed such plans. And then on the slide, you can see the guidance note that was developed with the partners to support the development of these plans. So country coordination of RCC is obviously very important, but not only in the traditional sense of coordination in terms of identifying gaps and avoiding duplications, which is obviously important, but also to make sure that a number of key functions are performed at country level. And I will very much build on what previous speakers have said in terms of some of the elements which need to be coordinated. So let me highlight some of these functions. One of the key steps for COVID, but also for I would say any collective approach to community engagement, is really about assessing the preferred and most trusted communication channels. We talked before about trust, so that's definitely an important element. And with measures of confinement in most countries, obviously we strongly rely upon indirect engagement through digital platforms, social media, traditional media, etc. That's on the slide. You can see one particular example. There are obviously many others, but that's one coming from South Sudan, where REACH, which is, I'm sure many of you know them, but an organization that is specialized in needs assessment, they put together information in relation to preferred communication channels, and the information they provided shows that radio stations was the preferred channel to access trustworthy news. As we know, in many situations, face-to-face interactions tend to be the most preferred way. Maybe it's a bit of a generalization, but that's been true from several of these assessments, but obviously more challenging in the context of COVID. But that's still very important to have this type of information. And the assessment I'm referring here is also covering elements such as languages, which is clearly very important as well. What are the languages being used in a particular context? This one was also looking at the mobile phone coverage. So again, another important aspect if we were to use tools which need mobile phone technology. Another key functions of country-level coordination is to ensure that there is a provision of timely and accurate information to the population. And that's, I guess, for obvious reasons, very important, particularly to avoid that we start providing incoherent or possibly contradictory messages. And most RCC coordination group would have as one of their functions the need to decide and work out the best communication approaches, define the content of messages, and so on. And so that's a very typical activity. Another element which we find as well in terms of coordination, obviously specific partners would have different expertise, but that's things which are always very important to bring around the table is the work around tracking rumors. And again, we've heard Alexandra talking about this just before. On the slide, you can see a couple of examples, one in Asia, which has been at regional level, some rumor tracking on the basis of social media posts in multiple languages spoken in the region. And again, in South Sudan, another example from this country, where different partners have been working together to develop rumor and perceptions tracking overviews. So these are the sort of tools that come out done by partners, but can be triggered through these coordination mechanisms. And very important information that can inform the response. Just a few more points in terms of the coordination at country level. One of the very important aspect or function of RCC coordination is obviously around making sure that we use evidence and community feedback to inform decision making. And in many contexts, we've seen that the existing feedback mechanisms have been somehow repurposed for COVID response, and that's something that makes a lot of sense instead of setting up something completely new. So for example, in Pakistan, we used, as UNICEF, we used the polio hotline for COVID, which was already there and very dynamic. Similarly, in Afghanistan, there's a humanitarian hotline called AWAS, which has been established a couple of years ago, and again that's been used for COVID. So they've received it's actually online, and I checked today. They received something like 1,800 inquiries specifically on the virus. Feedback mechanisms are an area which needs a lot more effort, I would say. In MENA region, we did a mapping, and we found that out of the countries in the region, only 5 had well-functioning feedback mechanisms. And that's not just as UNICEF, that's really looking at the collective here. So that's an area where which we definitely need to prioritize and make sure that our decisions, programmatic decisions, are based on the feedback being collected. And that's definitely an area as well where HCT and UNHCT can should support and promote in some ways. I think that's more or less what I wanted to cover in terms of the coordination at country level. Just to flag up maybe a few things that we are doing globally, obviously in support of efforts at country level. We are now in the process of strengthening the global coordination around RCCE through the establishment of what we call a collective service, which will very much come in support of these country efforts I've described. You can see this diagram that shows, hopefully, I don't know if you can see very clearly, but that shows more or less how we've structured this. This is still work in progress, so don't take it as final, but very happy to share information separately. Just to mention that this collective service for COVID-19 was recently presented to the IEC principals, and we have some very positive support. And it has multiple functions. I won't go into all the details here, but I would say one of its key objectives is to inform the operational and strategic decision making on the basis of social science analysis, community feedback, etc., collected across the response. And there are a number of tools that we are currently developing to make this happen, such as a dashboard with real-time information, which can synthesize the various information and data we're receiving across the response. So it's a pretty massive endeavor. But I would say a very important aspect of this collective service, and I'll finish here, is really about supporting partners in countries and making sure they receive when they need, because it's not always the case, but when they need, receive technical support. So there has been a number of guidance and tools being developed. We've actually set up in the IEC results group on accountability and inclusion a special page where we've put all the existing guidance in this area of work. So you're welcome to take a look. We will also set up some rapid response deployment capacity to support countries which have yet to be identified, but those who require some additional support. This capacity will be based out of the regions, starting in Africa regions. We will also have a help desk function, and I'm sure in the interim until this is being established, hopefully very soon, any of us are more than happy to provide any direct support or if there is any question. I'll leave it here, and again, very happy to take any questions. Thank you.
Thank you very much, Charles-Antoine. So it's beyond coordination. It's really about togetherness and collectiveness. We got your message loud and clear. I already have two questions to the presenters, and then I will give the floor for 2 minutes to our colleagues from UNHCR who want to bring some complementary information. The first question is from a she who told me that they are asking you, they are interested in concrete experience where WHO worked with clusters and others to adapt messages using AAP tools and engagement spaces without creating parallel tools. Melinda, over to you.
Well, I'll do my best to answer that question. I do think we've been working closely with our colleagues in UNICEF and IFRC. We've shared our scientific messaging and continue to do so on a regular basis. An exact example using, I think, the tools that you mentioned, I may have to shift it over to one of my other colleagues, since those would be the individuals that would have used those tools to adapt their messages. I know that there were several opportunities to take our highly scientific messaging and making it more relevant and real to those at the local level. So I think I'm going to now shift it over to maybe Charles-Antoine or Alexandra to maybe give an example of how maybe you took WHO's scientific recommendations but made it more pertinent for local communities. Over.
Charles-Antoine, Alexandra?
I think on that question, yeah, it really will vary. I'm trying to find a very good example. I think for us, possibly one recent challenge that we faced, and I'm sure most of you in your countries have faced, is around the guidance around mask usage, right? WHO has specific guidelines, and every country is applying these guidelines differently or having their own instructions on wearing masks or not. So For us, we try to, through these community feedback mechanisms that we have, like the one I was talking about in Africa, and especially at the collective level, I could emphasize more what Charles-Antoine was has presented on working together, and that's what we've been trying to do as much as possible through different channels to really understand what were the different confusions around mask usage, what were some concerns, and also trying to provide some tools and guidance that would be as simple as possible given the scientific evidence we have at this point. So for us, we adapted at the global level, but also at the regional level in supporting our national societies to do that, to provide guidance on how to wear masks. And if you are required to wear masks, how to wear them so that you ensure there's no cross-contamination, et cetera, et cetera. So we try to steer clear in a way of saying that you should wear masks or not, but instead really providing people the tools that they needed to know how to wear masks. So we're ensuring that we were listening to communities and understanding their concerns through the different tools that we already have in country and in place at the regional level as well, and at the country level to ensure that our guidance was adaptable to the different contexts. So I don't know if that answers the question. Over.
Yeah, this is Melinda too. I might add also I think they're around our hand washing guidance and use of alcohol-based hand rub. I think that was an area that we worked closely together on how to adapt those measures to low resource settings. And also just the ideas around physical distancing, again, at low resource settings. So I know jointly we worked on a guidance together on how to adapt these sort of overarching global messages to those types of settings. So that worked well additionally.
Thank you. The second question was about the stigma. You know, we have seen that also in DRC for the Ebola. So how do we engage with the communities and inform them and communicate with them to avoid the stigma of those who get infected by COVID-19? Melinda, Charles-Antoine, Alexandra?
I think that we actually wrote a joint document in the very, very early days on COVID and stigma. Interestingly, it was originally written to avoid stigma against the Chinese population, but then quickly switched over to avoiding, stigma for those who may be infected with COVID. That was actually a document that was led by IFRC, and then Stefan, WHO joined in that effort. So again, I don't mean to keep sliding it over to my colleagues, but perhaps Alexandra could highlight some of the work we did on that.
Yeah, I mean, stigma is ongoing also in different ways. I mean, as you said, Mindy, initially it was really towards Chinese nationals, and now it's completely shifted. I think one of the initiatives that actually we worked on with Mindy, which I really appreciate, was kind of really looking at the role that the media, local media especially, has to play in addressing stigma. So we did a series of webinars at the global level and also at the regional levels, and now I know there's some in-country webinars that are happening with local media to ensure that media have an understanding of the role they play in addressing stigma and also ensuring that it doesn't continue. And for instance, I'm part of a WhatsApp group for the Eastern and Southern Africa region of Africa with about 200 journalists from that region, from different countries, and where they share different information on COVID. So of course around misinformation, but I'm seeing a lot of issues around stigma. And I'm also seeing a lot of instances where, without realizing it, journalists are encouraging stigma, for instance, by sharing photos, photo IDs, of different people who might have been infected, and so this was especially the case earlier on when COVID-19 arrived in different countries. And so we had to explain to media why this was not ethical, why this was not appropriate, and why it would potentially create stigma for certain individuals, et cetera. So I think there's a real, we're talking about community engagement, of course, but I think we really need to leverage the different types of actors who might be contributing to providing information and can also help to address that. And I really do think local media has a huge role to play, and that we should definitely try to leverage that at country level especially.
And maybe to add to that, if I may, I absolutely agree with this. And another area which we haven't touched upon that much, but that's also actually very important, is to not only identify but also work with key influencers in the in the various places where we work, be it at national level but also more broadly speaking, and that includes at country level community leaders, religious leaders, etc. Different networks or groups, women's group, youth, community health workers, and so on. So there's a lot of work actually taking place in terms of working through these networks and influencers. There's also some work happening in terms of working with faith-based organizations, etc. So that's another way also to push a number of messages, and I guess pretty directly, I suppose, address this issue of stigma as well.
Thank you very much. For the participants, please don't hesitate to post your questions in the chat box, and those who can be unmuted to raise the hand if they want the floor. The floor is to UNHCR colleague who wanted to add to what the speaker said. Over to you.
Okay, thank you very much for this opportunity to also contribute from UNHCR side. So my name is Machthild Vrieze. I'm the Senior Community-Based Protection Advisor at UNHCR. So I would just like to flag that COVID-19 has very clearly shown the importance of timely risk communication, but also the opportunity to reinforce in general communication and community engagement. From UNHCR's perspective, through the investment on the age, gender and diversity and the accountability to affected people approaches, many operations had already invested before the pandemic broke out in putting in place different communication channels. And those have proven crucial during the COVID response. So thanks to that, previous investment, operations benefited from timely outreach, but also passing the preventive messages out on COVID-19. Our experience has also shown the importance to be inclusive in our communication. So, for example, to make sure that messages are adapted to youth, persons with disabilities, so there is no one-size-fits-all when it comes to risk communication and community engagement. So it needs to be contextualized. I'm very much aware about the time, and I would very much like to raise your attention to a document that has been posted in the chat box, which gives a bit more specific examples of different interventions on risk communication and community engagement that have been put in place or that have been reinforced by different UNHCR operations, refugees and IDPs, the same. The document is called Putting People First, UNHCR's AAP in COVID-19. So thank you very much for this opportunity to add on to this, very interesting webinar. Thank you.
Thank you very much. Any other questions from the floor? Colleagues? Okay, so if no more questions at this stage, I would like to give the floor to Tanya. Tanya, please, can you tell us how do you engage actually as humanitarian community and actors with communities to maintain our accountability to affected people commitment during the COVID-19? Over to you, Tanya.
Thank you, Najat. Can you hear me okay?
Yes, we do.
Great. Well, thank you for inviting me today. I see quite a few familiar faces on the attendee list. So I recognize I'm not saying anything new, but making some unapologetic reminders and drawing attention to some of the challenges we're seeing around accountability to affected people and COVID. So I want to take a few minutes of your time to focus on the accountability aspects of our work, and particularly regarding complaint mechanisms. And we are at the moment learning about some of the challenges with COVID and how we need to adapt those complaint mechanisms, and also want to continue sharing some resources with you, as well as potentially asking for some of your feedback. So accountability means lots of different things to different people, but I'm just going to boil it down to kind of these three principles for today: that you let people know what to expect, you deliver on it and people can feedback positively, or when you don't deliver, people have the right to complain. And then, as we heard earlier from Alex, we adapt and learn based on that feedback that they're giving us. So next slide, please. So this is the idea that we tell people what to expect. Sounds fairly basic, and it's the premise of what the core humanitarian standard was based on. The CHF, as I expect everyone on this call to know and be able to recite by heart, was written with a set of 9 commitments that we've made to people affected by crisis. Again, being the idea that if you know what to expect, they hold us to account. But it was written in a way that was for us as organizations to measure. So recently we've worked on putting it into more understandable language. And this is what we call the CHS commitments in plain language, which is available on the CHS website. And we've been doing a big push through COVID to ask particularly our CHF Alliance members to have these in as many displayed places as possible. Again, this idea that it's really important that as a community and that collective that Charles Antoine was talking about, that we're all holding ourselves to those same principles and letting people know the very basics of what humanitarian aid is about. Next slide, please. So if we've told them then what they can expect, we need to have the complaint mechanisms in place that they can let us know and be able to give their feedback when they're not getting what those expectations are. And this is really about, and I want to kind of keep drawing this attention around the complaint and effective complaint and feedback mechanisms. I'm not going to go into this, but just a reminder, of course, to us all that they have to be accessible, they have to be safe, they have to be confidential, and they have to ensure a level of transparency. So if I can go on to the next slide, I'm going to focus a little bit more on kind of what that means now for COVID. If we can go to the next slide. Sorry, no, back. There we go, thank you. So what we're doing at the moment at the CHF Alliance is a survey with Erasmus University and working with predominantly our membership, but also we've asked for ISD members as well to contribute to this, which is how are you adapting your complaint mechanism at the moment when, of all the issues that we've heard about from the previous speakers, the challenges of being able to access communities and the people themselves. So we're doing this survey. From that, we'll develop guidance, which I'm happy to share with the peer-to-peer network. But I think the main pieces of this that we're finding is about the consistent testing and checking of your complaint mechanisms right now. Nothing is working as normal, and we have to work on that premise, and we have to work on the premise that more people are likely right now in these sort of unusual times to be needing or wanting to have a feedback channel that they can rely on. So we need to be testing and making sure that all the links in the complaint mechanism are working. We have the right referral pathways. And then interestingly as well, one of our findings is the importance of branding, which isn't something as a sector we're usually promoting, but the importance of branding the complaint mechanism channels for the issues that other speakers have pointed out around misinformation and mistrust at the moment. And then, of course, as well, the reminder to us all that none of us can over-communicate on kind of PSEA at the moment, and highlight the expected behavior when responding to COVID-19 within our organizations, and making sure, again, going back to my earlier slides, that we're continuing to communicate to the affected people about what behavior is acceptable, what it's not, and what they can do when behavior is not in compliance with what they should expect. So there's a link there, maybe we can share it within the, with you all through the slides, but please do contribute to what you're learning and adapting as humanitarian leaders on your complaint mechanism, and we look forward to sharing more of the guidance with you when it's complete. If we can go to my final, almost final slide, please. I just want to take the opportunity as a kind of reminder back for those areas I've just highlighted of why this is important, and take the opportunity of having the humanitarian leadership here on this call. These three principles I've outlined, that we need to tell people what to expect, that we need to have effective complaint mechanisms, and we need to be learning and adapting based on this, is obviously, and I hope, of course, nothing new to any of you. But I want to show you this slide, which I think should all give us cause for concern. This is our latest CHF verification data from 100 data sets, which we're about to publish in the Humanitarian Accountability Report. Commitment 4 is around communication with people. Commitment 5 is that we welcome and address complaints. And commitment 7 is we improve our organizations as we learn based on that feedback. And I think I just want to highlight to you that these are the lowest of the CHF commitments in terms of how, as organizations, we're meeting these commitments we've made to affected people, and particularly the issue of welcoming and addressing complaints is staggeringly still low. So I just want to prioritize that, show that to you, and make the push as humanitarian leaders, particularly now at this time where we can expect complaints to be going up. You're paying attention and following up on how your complaint mechanisms are working at this challenging time. And then just to point out, if you can go to the final slide, that we have there's many resources out there. We've heard about some today, but we've been collecting the various resources that many of you have been putting together, which helps us show how we can meet these CHS commitments during this time. And please, if you have any more to share, please let us know, because they're being found very valuable by the membership at the moment. So thank you. Thanks for that opportunity. Over to you, Najat.
Thank you very much, Tanya. Now let me give the floor to Fiona. Well, Fiona, I mean, you are operating in a very complex environment. Your organization, the agency coordinating body for Afghan relief and development, ACBAR, has over 150 NGO members in Afghanistan. So what approaches have been developed by ACBAR for community engagement during COVID-19? And please share with us some concrete examples. Over to you, Fiona.
Yeah, thank you so much, Najat, and hello everybody. Thanks very much for having me on this very interesting webinar. Yeah, I would just like to maybe give a bit of context to what I'm going to talk about. So Afghanistan, we are 152 NGO members, both international and national, in our forum, and we, as Najat mentioned, we're covering both humanitarian, development and peace building activities. So I think initially for all of us, of course, it's been very tough the first few weeks of this. We've had, lockdowns in most of our major cities in Afghanistan, starting from Herat on the 25th of February. And international flights stopped in mid-March, and then Kabul has been in lockdown since 28th of March. So we've been, through the same thing as many people in many countries. I think the initial reaction of most NGOs was to go through development of protocols to keep their staff safe, and that's taken some NGOs, international NGOs, have done it more rapidly, others have taken longer. And for national NGOs, it's been a big learning curve. So I think with those in place, then people have started to work with communities. And some NGOs have not started to work with communities because of lack of resources, or because the government has closed down, some education programs. So those working in education have not been able to work directly with communities. And then we also, because of the lockdown, we had to negotiate access with the government to be able to move around. So I think those things all took time. And I think the community engagement, in fact, when it took off, we have been able to upscale our existing programs and use the staff from our existing programs. So I think that's what's useful, that we can use the messages that have been developed, of course, by the international community and by WHO and our Ministry of Public Health here in Afghanistan for all the sectors that we work in: agriculture, education, health, wash, nutrition, you know, and others. So I think what we have been able to do is adapt what we have already. And I agree with, you know, all the previous presenters that, you know, who do we target? I mean, I think having the trust and the relationship with the local communities is really important already. And then you have to make sure that you're reaching the right people in the community to spread your message. So community elders, obviously, as we've already mentioned, the influencers, the religious leaders, and the government to a certain extent has been very successful in this. I think we have had good messaging coming out through media in Afghanistan and from the government side to illustrate that we have to follow some of these protocols in order to stay safe. And I think what we can see now, we've got a risk community engagement group as well, which has done some good work in terms of asking for an assessment to be done through REACH. And we've had some feedback that many parts of the country, there is a good understanding of what COVID-19 is and what needs to be done. But having had this initial messaging phase and having NGOs having adapted their staff and their programs to spread these messages, I think now we're now facing the challenges. And then, I mean, the challenges, as we've already mentioned, are many. But I think in the terms of Afghanistan, the challenges are also because of the existing violence and insecurity that's going on in the country. So in fact, COVID is an additional complication for us. I mean, we've already had quite a lot of restriction on movements to many parts of the country. So negotiating access is what we've already been doing in terms of with the opposition, the armed opposition. But now we have to also negotiate access on the basis of how we do the access in terms of COVID-19. So I think it is difficult in many ways because communities will receive you and will want to have your support, i.e. your humanitarian support. But now we're coming in and saying there's a lot of restrictions because of COVID. So we've seen now some concerns about this very low female access to information in many places. And that's obviously in traditional areas and also Taliban-held areas. And some communities are resisting the messages of social distancing and what COVID can, what the impact can be, and they're saying that this is, you know, propaganda from the government, or we're good Muslims and we don't need to listen to this. So I think although the messages have gone out, now we're starting to see pushback on some of the messages. And also frustration because, you know, lockdowns and restrictions on movement have affected the livelihoods of very poor people anyway. So we are now starting to see as NGOs that livelihood is in fact more of a priority for many people in the country. And they're looking for a development in the economy. So we can't keep this type of restrictions in long term. So I think we're asking now ourselves, how do we manage on this in a second phase, in the next 6 months, in the next year? How do we in fact manage community engagement when we have these challenges? And I think some of the comments that have been made already today are very important. You know, we need to link up existing programs and actors and not waste our resources. There's a lot of concern in Afghanistan because we're not able to track or in fact test enough people. So we have a lot of health workers who are now being infected, so we don't have enough materials. So there's all the problems that many countries are facing here as well. And on top of that, we have difficulties in accessing some parts of the country because of the violence and the insecurity. So I think we would say that we have to pool resources as much as possible. And I think a lot of the materials that are coming down from the global level are important. But for us, you know, for many NGOs, it's really difficult to sift out what they can use, and then we have to translate everything into local languages. So it demands huge resources, and there is pressure on everyone to get going as soon as possible. So I think we're facing a very complex time, and I think it would be good, in fact, to have a bit of a discussion on how we see the next period in terms of community engagement and using our resources as best as possible. Over to you, Najat.
Thank you very much, Fiona and Tanya. Now I will take questions from the participants. And we already have the first question, which is, please tell us about the mechanism that can be applied for community engagement in very low-income communities, such as in informal settlements, where digital devices are not available, and most of the people do not have access to it, and also in case of lockdown. Over to you, Fiona and Tanya. Tanya, you want to go first?
Sure, thank you. So what I would say to that is I actually think it comes back to some of what Alex showed with her slides with the IFRC and some of the different mechanisms we have to be able to use. Obviously, we're all going to be challenged with how we can reach people and trying to adapt that. For a long time, our sector has suffered with sort of complaint and feedback mechanism. We've got all the stories of where boxes have been placed in the wrong place. We've got issues with where data and being able to channel where WhatsApp messages don't go to the right ones. There's no one size fits all for this. It's about adapting and changing and trying to be acute and listening to the communities. This is it ties in as a whole package. And so I think we've just got to be smarter about how we're having a range of different communication methodologies, that we're having as many. What's coming out from our research is we have to have as many numbers as possible, and then it's up to us as the organizations to be able to test and check where those numbers are coming together, and that we've got the coordination mechanisms in place to be able to support that. I think, you know, beyond that, and I'm sure Fiona can talk to this from an ACBAR much more, what this boils down to is, with all of this, is how good our systems were before COVID, in terms of that kind of trust that local community has and with the local partners. And I'm sure Fiona could talk to that more with the work of ACBAR. But I hope that we can share more concrete guidance when we've done this review of kind of what is working and any sort of good ideas, but it's not going to be a one-size-fits-all, but testing and adapting and communicating. Over.
Thank you, Tanya. Fiona, please. Fiona, will you stay with us? Yeah, I think it's connection issues. Alexandra, do you want to come to provide your perspective as IFRC?
Yeah, I mean, I couldn't agree more with what Tanya just said. I think we need to think a little bit out of the box, and of course, informal settings represent specific challenges. Just for instance, when we provide information to people in informal settings, normal physical distancing guidelines are very difficult to apply in informal settings, right? So how do we try to understand what is possible, and how do we minimize the spread of COVID-19 potentially in an informal setting, but especially adapt that guidance to those settings? And that's when it's so essential to listen to communities. And this is where we need, as Tanya just explained, so I won't repeat what she said, but we need to try to innovate a little bit. Of course, technology might not be an option, but this is when, as Chantal mentioned, we need to rely potentially on influencers in the community, whether they're community leaders or groups that we have already engaged with in the informal settings. And this is especially important in a context like this, where we need to work together. So I don't think one individual organization will have any impact in a circumstance like that, given all the challenges. This is when I think the collective is so important to work together and see which organization is present in, and which organization has done or provided services in these informal settings and have already contacts, or what kind of community engagement activities have worked in the past, what is still possible given the restrictions, and work together on finding solutions for better community engagement. And so this is, I think, an example of where not one individual organization can really have an impact. Over.
Alexandra, Fiona, are you back to that? Fiona?
Yeah, hi, I'm back.
Did you hear the question?
And
Fiona?
communication.
Have you heard the question?
Yeah, can you just repeat, Najat?
Yes, sure. So what are the mechanisms that can be applied for community engagement in very low-income communities, such as in informal settlements, where digital devices are not available and most of the people do not have access to it? Over to you, Fiona.
Yeah, I mean, I think, you know, we do have quite good telephone networks in Afghanistan, but women don't always have access to the telephone in the household. So, you know, a lot of surveys, a lot of information is passed by telephone, and then radio has traditionally been the strongest medium for many parts of the country. But a lot of the sort of initial replies or return on the surveys and assessments is that it's face-to-face that really counts for people. It's the people that they trust should be people that they know. So it's the, you know, the person in the street who people trust, the neighbor, or the wakil, the leader of the street, or in the community it's the village leader or the midwife. So it's actually, yes, those key people who people trust, and those are the people who should have the consistent messages, of course, and not all be contradicting each other. Over.
Yeah, thank you, Fiona. Charles-Antoine, I know that UNICEF is very active and very much engaged, you know, in adapting as well. Can you please provide us with some examples? Over to you.
I'm assuming examples on the same topic, right?
Yes, absolutely.
Yeah, no, definitely. I think before doing that, I mean, I can certainly try to think of examples. But before doing that, I think we probably need to be also a little bit cautious in terms of the assumption that, you know, face-to-face interactions are just gone. It's not possible, and we should rely upon you know, digital platforms or any similar tools, etc. I mean, obviously that's the case to a large extent, but I wouldn't say that's completely the case. I think maybe before again going more into examples, a general consideration as well. You know, this kind of conversation around community engagement, accountability, risk communication is very connected to the thinking and our commitments around localization. So I think that's an important element to flag up. And I think that's sort of, not to say we were not convinced before, but this is, you know, encouraging us even further to work with local networks and local organizations and so on, which in some cases would still have some kind of more direct access, I would say, obviously depending on the context. I mean, one example I came across was actually interesting. That's in Indonesia. I don't have all the details, but it's basically where we've been working with the National Disaster Management Agency there and several partners to set up what they call a volunteer desk for COVID-19. And they have actually mobilized over 24,000 volunteers from 29 different occupations. I imagine that's also something that has been done very closely with the National Society of the Red Cross there. So that's a very strong, you know, powerful group to really not only raise awareness on COVID-19, but you know, mobilize these volunteers to have more direct types of engagement. I mentioned before, so the medical staff who do have these engagements as well. So that, you know, by going through these kind of frontline workers, I think that there's certainly some potential. I don't know if I've properly answered the question, but that's just some thoughts I wanted to share.
Well, I guess there would be follow-up question if there is a need for more clarification. Now I give the floor to David McLaren-Carr, the DSR in DRC. David, over to you. David, do you hear us?
Can you hear me?
Yes, please.
A very stimulating conversation, and thanks very much for organising. You know, I think the communication piece is often undervalued as a critical tool in any public health emergency response. If I may, I just offer a couple of random comments in the DRC context, where of course we have two global pandemics happening at the same time. Although there's some encouraging news on the Ebola front, COVID seems to be getting worse and spreading rapidly. I guess on the positive side, having had 2 years of experience with the Ebola response, community engagement is perhaps better practiced here by our RCCE team and the leads on that, given the experiences. But the experiences have not been very happy, as you know, and getting the community outreach and the education, sensibilisation correct with populations, sensitization, you know, if you get it wrong, it can have absolutely dire consequences, as we all know. We've had, you know, health workers killed in the field in the Ebola response. We still have problems of community trust, which is very, very much a difficult issue, particularly when it's led by or perceived to be led by foreigners. In the Ebola case, I think a very common perception was that essentially it was not only foreigners importing it, but then using people as guinea pigs in a global laboratory to test vaccines for Ebola. And you know, all sorts of conspiracy theories, unless well managed, can really get out of hand very, very quickly. And the same thing with COVID. You know, at the moment, our international staff in the east of the country have been stoned in markets, being called, you know, COVID. Again, this perception that somehow all of these diseases come from external sources, you know, is a really critical factor that one has to try and breach. The points that were made about, you know, targeting your audience and how do you actually convey the messages are really critical. I think in the experience of Eastern Congo, where you are not only working in a logistically very remote area where there's virtually no infrastructure, you're also working in an active conflict area of major insecurity and violence. I would say that most of the communities we work with are already traumatized by massive displacements, attacks by militias, Mai, and so having to try and send out public health messages in that context is very difficult, where in a way people have become a little bit immune, excuse the pun, to these critical health emergencies because of the prevailing context, which is of course life-threatening in itself. So, you know, what we have done is invested very, very much in identifying the communicators. And here I think it's very much important to emphasize the local element. Too much during the Ebola response, we had people flying in, including from the Ministry of Health in Kinshasa, which is a continent away, and they were doing a lot of this heavy lifting, but what they failed to do is to obtain the confidence of the local communities, because they themselves are seen as foreigners, even though they are nationals of the country. And it was a difficult thing, because the Ministry of Health wanted to deploy its own staff, of course, and there were benefits attached to that. DSA, other factors. But we, unfortunately, I think perhaps lost a lot of time in avoiding the local dimension by importing the communicators. And then, of course, not enough work was done on the anthropology of the leaderships and who do communities really look to in terms of respect and in terms of receiving messages. And I think we didn't have the anthropologists on the ground who could actually assist us in that. And of course, there's a lot of factionalism in that area. I won't go into it, but ethnic conflicts mean that you have to be particularly sensitive to identifying who are your audience and who are the people that you should, in fact, be conveying messages through. I just wanted to say, at the moment, we're basically coming close to the end of Ebola. But very important now, we need to put in place a survivor program for the nearly 1,200 people who have survived this, which is one of the highest numbers ever. And then the question of stigmatization and stigma comes into the debate. You know, how do we provide assistance to these people without them becoming privileged recipients, therefore creating certain inequalities in the societies? But also, how do we make sure that we can continue to have comprehensive surveillance and look after the survivors who, as you know, can be infectious for up to 2 years after they've been cured. And so the approach is not to really make it an individual approach, but very much to work through the communities. So all the programs will benefit the communities as a whole and reinforce health systems on behalf of everyone, so that these people come back into the society in a way as heroes, because they also become the people who are in a way responsible for ensuring that not only do health systems strengthen, but that's also surveillance of these communities, and we can assist them in many other areas. But I would say that this is an absolutely critical area. I think sometimes it's a little bit, the groundwork is not done enough on RCCE, on risk communications and community engagement before we actually engage. And then in fact, we should put it really front and first before we have any sort of public health emergency strategy. And it's, it's really critical. I'm happy to say here in the DRC, with the UNICEF, with IRC, with other partners, and of course WHO, we have given a lot of accent to this as we scale up the COVID prevention strategy, benefiting in a way from the Ebola in the East, but we also have many lessons learned, I think, that we don't want to see repeated, which we will use to improve our performance this time around. Thanks for letting me have a few, just a platform for a few random comments, but I do find the conversation extremely interesting. I think the main point is that there's no one size fits all. It really, the RCCE strategies need to be tailor-made, bespoke arrangements for each of the contexts that we work in. One really needs to have eyes and ears on the ground to ensure that we're targeting correctly and in bringing in the right partners to make sure that we're making it happen. But I think it's a really rich and stimulating discussion, and thank you for letting me be part of it. Thanks. Back to you, Najat.
Thank you very much, David, for sharing with us, a country perspective, which is really very important. And I hope that other colleagues will do so, but also for bringing the post-COVID. We are still in the middle of managing the emergencies, but at a certain stage, we will have to start also thinking about what after the crisis. I have a request for the floor from our colleagues from UNHCR. So over to you. 2 minutes, please, not more. Okay. Roberto, you have also asked for the floor. Roberto is the RC in Argentina, and as you know, several middle-income countries are participating to the global call, to the global. Roberto, the floor is yours.
Yes, thank you very much, Najat. First of all, thank you for reaching out to a high middle income country, which happens to be also a G20. That nobody knows it. I mean, we know it in the country, but 11 million Argentinians right now are receiving food aid by the state, the government, and most of the resources the government is putting forward right now to respond to its own COVID-related impacts are resources that are debt-related. So really a pity that we are having countries that are having to access to indebt themselves in order to respond to humanitarian crisis, particularly in a period in which the Secretary General calls for a global and uncoordinated solidarity. I mean, that's we do have the possibility to access humanitarian resources, but obviously there are countries that are in much deeper problems than Argentina. But we consider that we should have windows, at least regional ones, that are targeted at middle-income countries that not necessarily are accessing now these resources. Places like Argentina, I've been in Palestine in 8 years and a half in which I've been working there. I never heard of a child dying out of food insecurity, chronic food insecurity. In Argentina, in the last 8 months I've been here, I've seen the cases of 10 children of indigenous communities in the northern area of Argentina, which is actually connected also to a dry area with Bolivia and Paraguay, where children have died. So there are very high and deep humanitarian manifestations. And I consider that it's important, if not providing massive amounts of resources to these countries, that the actual analysis of the humanitarian impact on middle-income countries is deepened by the humanitarian community. I am very pleased to see that there are YASC colleagues, and I must say that organizations like ECHO have been very much forthcoming in Argentina, providing resources in a context in which resources from others have not been forthcoming. Obviously, I'm advocating for Argentina, not only because I'm here, but because I see the humanitarian manifestations that are deep. Thank you very much, Najat.
Thank you very much, Roberto. Before giving the floor to our colleague from UNHCR, is anyone from the panelists, does anyone want to reflect on what Roberto and David said? Okay, well, it looks like they all agree with you. Thank you very much. Well, over to our UNHCR colleague. 2 minutes, please.
Yes, hello, can you hear me?
Yes, please.
Thank you very much. I won't take 2 minutes, I'll take 30 seconds. I just wanted to say, you know, as one who's worked for a very long time on these issues around community engagement and communication and all of the things we've been discussing today, I hope that the one takeaway from this is that this work is important. And we see that those operations, and there's many of them that have invested in this area before COVID, are really benefiting now. So I really hope that collectively we'll focus more on this work and prioritize it when we get past this terrible time, and understand that it is really central to good humanitarian response. That was the point that I wish to make. Thank you.
Thank you. Well, you know, I mean, we learned a lot with the COVID-19, and we are adapting every day. Many things are known now, but many other things are still unknown. So we still have to learn, but learning also from our colleagues in the field. Please feel free to share with us any concrete example or good practice you have already in the field, and we will be very happy to post it in our website. Let me thank, on behalf of all the participants, our speakers. And it's your last chance if you want to add something, speakers. Alexandra, Fiona, Melinda, Tanya, Charles-Antoine.
Tanya here. If I could just take 2 seconds just to echo what the last gentleman from UNHCR said. Like, we have to be able to learn from COVID. We're in a crisis, but it's a long drawn out crisis that we should be able to learn and adapt to. Our humanitarian accountability report, which is about to be launched, and I showed you some of the sort of not so positive figures out of there. One of their main challenges, which is a common thread coming out for the sector, is that we're just not learning enough. We're not learning and adapting. I think there's some positives, like our colleague from DRC said, about how we've learned from Ebola to take into this pandemic. But I think as the sort of and being from the peer-to-peer, this being put on from the peer-to-peer, how do we capture and actually learn and implement from what we're learning in this response? Thank you.
Thank you, Tanya. Alexandra?
Yes, thanks, Nathan. I mean, I think what needs to be underlined, maybe that we didn't talk about, is the need to resource community engagement and accountability initiatives. I mean, it takes resources, it takes people. I mean, I know we're restricted with face-to-face engagement, as we discussed earlier, but still, this area of work needs to be resourced in an emergency, and especially under COVID. We're seeing more and more investment around this, but I think hopefully the silver lining of the COVID-19 response is that it brings more attention to the need for more accountability and for better community engagement, and that going forward it will be resourced. And not just, of course, we're sitting here at the global level on my side, but really in country and how this is resourced really should be made a priority. I just wanted to otherwise just thank you, because I think a couple of years ago we probably wouldn't have had the opportunity to talk to humanitarian leadership on this important area of work. So I think we've made such a huge progress, thanks to your leadership, Najat, and peer-to-peer, to really bring this to the attention and have this interesting discussion with leadership. So thank you so much. Over.
Thank you very much, Alexandra. Charles-Antoine?
Yeah, I would thanks, Najat, and I would definitely build on what Alex just said. I can see, looking at the list of participants, that there are a number of familiar names who were at the workshop or tabletop exercise you convened, Najat, with a number of humanitarian coordinators, etc., at the end of last year. And that was a very refreshing and useful conversation, and also very practical in some ways. But the key point there for me was really to have this leadership exchange and engagement. And you know, I think the interest during this webinar shows again the importance of that, but also the recognition that you know, anything we do, you know, technically speaking, won't go very far if we don't have this leadership support, but also push sometimes. And I think that's very encouraging to hear some of the comments today. And also the fact that, you know, we're building on something that is already out there, so it's not that we have to reinvent everything. And I think we can only do that thanks to the efforts that have been gone into that for a number of years. And again, very encouraging in that sense as well. Thank you.
Thank you, Charles-Antoine. Fiona?
Yeah, thank you. Yeah, just I think another point that maybe I should raise earlier is localization, in terms of this can really play a strong role in our CCE activities. So, you know, using local actors, local civil society, local NGOs, they really are able to take forward these messages, you know, very well. And sometimes there's a reluctance to use local partners in a crisis, because everyone's saying, you know, we need to have valuable, trusted, existing partners. But I think this is actually a very good opportunity to forge new relationships, you know, and contribute to the nexus. Thank you. Over.
Thank you, Fiona. Melinda? Oh, maybe Melinda has left already. Well, thank you very much, really, to all of you. And please, colleagues from the field, don't hesitate to come back to us or to send us an email if there is a very specific topic you feel we need to address in the same format of this webinar. Well, thank you very much for your participation, and until the next webinar, which will be in 2 weeks, I hope you will stay safe and healthy. Thank you very much.